quick testing, guys. Testing, 1, 2, 3. Can you hear me through the webinar? Testing, 1, 2. If you can tell, but we've added some new setup. We've added some so much for being here. To the right page. One of the ways that we help practitioners here is through our weekday webinars. And today's class is going to be a preview of CT Holman. You can find it there. The next for after emotional CT has been practicing Chinese medicine. And CT, if you can do a quick testing on your end to make sure they can hear you properly.
Everyone, and thank you so much for that introduction, and welcome to she said I've been practicing since 2001, and I've actually helping to prevent future impact, looking in depth anything in terms of diagnosis and treatment tools. And my 3 treatment approaches. So I found through studying with my teachers and through the years of working with patients, really a treatment approach that I find very effective. It's one approach. It's not the only approach, but it's something I encourage you guys to try. And you know, I welcome everybody here from all over the States. I saw people from Europe. So if you guys feel welcome to, you can say where you're watching from so we can see where everybody's at. And we're going to get started here. We have an hour, and so it's a very in-depth concept and topic, but I'm going to try to get as much information as possible for you guys. If there are any burning questions, I'm going to save time at the end for a little bit of questions if we have time for that. So, and you can always put them in your boxes, in the chat box here. So I'm going to be showing pictures of people's transformation because, you know, pictures worth 1,000 words. So I ask you guys not to take photos of the pictures because they are patients who shared their stories here and shared their pictures, and I want to respect them. So we're going to get started, and beginning with this woman here. She experienced emotional trauma. She had been through a pretty intense divorce, and she had become then a single mother, essentially. And she was feeling very alone. And what this trauma did is it triggered a past trauma. And this is pretty common. You guys probably see this in your practice all the time, where someone comes in who's had a recent trauma, but it's bringing up a trauma they had maybe in childhood. For her, it was when her mother died when she was a young child. So she was feeling very alone, hopeless, depressed. She was having different aches and pains and digestive issues. We'll talk more about that later, how we kind of individualize that. But I worked on helping first get her feeling centered and what I call gathering the chi. And so I did a treatment, and she started feeling better. I do a lot of facial diagnosis, which we're going to talk about a little bit today. And in facial diagnosis, there's so much we can see in terms of changes, but we'll talk about that later. But just you can see even just her shen starts to improve, the glow under her skin, the light behind her eyes. And then after a few more treatments, she really felt a lot better. So this is really a transformation process that happens for people. And when we look at emotional trauma, we first understand what is emotional trauma, and then how do we diagnose it? What's the physiology? What's happening in the body? How do we treat it? And like I said, I have a 3-staged approach. I find it's very effective. And then there's multiple treatment modalities that I use. I use acupuncture. I use Chinese herbal medicine. I make formulas for people. I have a whole pharmacy here of over 200 herbs. I use drumming, which we're going to do a little bit of drumming today just for a moment, and then more on this weekend. I use Qigong, I use affirmations, I use nutrition, and then lifestyle therapy. So there's many things that go into helping someone process their emotional trauma. We'll do some case studies over the weekend. When I teach this class live, I do clinical theater, but we will be doing some demonstrations in class. So if you guys can tune in, that'll be great. Before we get really into the lecture here, I want to honor my teachers quickly because they are who really helped pass on this information to me, and they're standing on my shoulders right now as I bring this information to you all. So one of my teachers, Dr. Wang Juyi, I started studying with him back in the late 90s, and he taught me, of course, channel palpation, but also channel theory, and that's a big part of what I utilize to analyze and treat emotional trauma. My Qigong teacher, who teaches me shamanic medicine, divination, astrology, Qigong, of course, calligraphy, Master Zhongshan Wu, who teaches me a lot about understanding the spiritual aspect when we treat emotional trauma. My other teacher, who teaches me facial diagnosis, Lillian Bridges, who now we work together, and I work for her company, Lotus Institute, and we teach all over the world teaching facial diagnosis because it's becoming more accepted. But facial diagnosis is a diagnostic technique that's been utilized since the beginning of Chinese medicine back in the shaman times. Another one of my teachers is Brian LaForgia, who teaches me pulse diagnosis. I'll be sharing some pulse diagnostic insights today, briefly, but more in depth over the weekend. I utilize the Shen hammer pulse technique, lineage system, and so that's what I utilize to help with diagnosing treatment for emotional trauma. And one of my other teachers is Dr. Wei Che Young, who teaches me acupuncture, specifically Master Dong style acupuncture. You guys have heard of tongue style acupuncture? This is my teacher, Dr. Wei Che Young, who holds the lineage for the Master Dong style system. Okay, so emotional trauma. Trauma originates from the word wound. And I think it was Rumi who said, wound is what lets the light shine in. And what I think he meant by that was when you experience an emotional trauma or any kind of trauma, once you process it, it becomes a metamorphic process where you're able to then open yourself more to your full spirit, to your destiny path, to these kind of things. But if it stays stuck in the body, it becomes what we know as post-traumatic stress disorder, PTSD. Now, emotional trauma is not just combat trauma, because back in the 1980s, that's where they coined that phrase, PTSD, and that's what originally was applied to just veterans who'd experienced combat trauma. Well, now that diagnostic has been expanded to include people who've had all kinds of emotional traumas. This could be birth trauma, divorce, loss of a loved one, childhood trauma, natural disasters, getting a really intense medical diagnosis. Many things can be called emotional trauma. Some people respond to them differently, and some people are able to, process that emotional trauma, what happens at the time, move forward, that's it. But for most of us, an emotional trauma happens and it gets stuck in the cells, in the tissue, in the energy field of the body. And until we're able to process that fully, it still can disrupt the physiological systems. So our homeostatic balance is out of order. But once we're able to transform that trauma, it's like this, image here on the screen with the butterfly, that metamorphic process of really flying free into your full destiny path and into your life. So, as she said in the beginning, I have written a book, Treating Emotional Trauma with Chinese Medicine, published by Singing Dragon. It just recently came out, and in the book, I talk about all these different things. I talk about, the diagnostics, the physiology, the treatment principles, and then also how do we prevent the impact of future trauma? Because inevitably, being humans, we're going to be experiencing traumas through our lives. And it's about shoring up the energies from the different organ systems to then allow someone, if they feel emotional trauma, to just have it go through like a wind. We know that emotions in Chinese medicine are not a bad thing. We're human. We experience emotions every day. What it's really about is having that emotion be like a wind and just come through our body and then just keep going. What can happen is if an emotion really upsets our body physiology, our spirit, then it becomes trapped in the body until we can have some help to process it. We'll talk a little bit today about this, but more on the weekend about the correlations between Western medical treatment and Eastern medical treatment for emotional trauma. There's a lot of similarities, and there's a lot of things that we can learn from Western medicine as well from their diagnostics. And then, like I said, we'll be talking about some case studies too. So in terms of the physiology of the body, I break it into 3 sections. There's really the traumatic event. This is when someone first experiences an emotional trauma. Now, one thing just also to note with emotional trauma, it's not just experiencing it, but you can see an image of an emotional trauma. You can hear about an emotional trauma. These can also create emotional trauma trapped in the body. And it can also be inherited. So there's a lot of work being done in the Western medical field to prove what we've known for millennia in Chinese medicine, that energy is passed down through the generations. Now we know genetically, if you're tall, that can be passed down, but so can emotional trauma. So trauma that your parents or grandparents, up to 7 generations, can be passed down through the DNA, and we know that through the Jing and through the blood. So when those get triggered, it scatters the energy. So the energy in the body goes in all directions. Normally it's going in this very rhythmic motion, but then it becomes scattered. So that's a traumatic event. Then what can happen if it doesn't get processed at that time, it remains stuck in the body, and then things get triggered and the person relives that emotional trauma. What it causes is heat and wind, as you can see here in this diagram, drawn by this great illustrator, Christine Wright, from my textbook. You can see this heat can rise up and wind can really stir in the body. Then, if it still remains stuck in the body, it becomes this blockage for the channels, for the organ system. So we'll talk about what that does over time for the body. So really the first stage is a traumatic event. And like I said, it scatters the energy. And so the main organ system that's in charge of rhythm and the spirit is the E, the intent of the body. It's processing food and fluid. It's processing ideas. It enjoys and loves the rhythm. As you guys know, we're in the year of the Earth Pig, and this year is very much about family, being home, resting, being in rhythm. Well, what happens with that emotional trauma is it shocks that rhythm. And so the rhythm is no longer smoothly flowing, and it distresses the earth element. Also, the spirit gets disturbed because the spirit is, of course, housed in your body, and the Shen is housed in the heart, and the spirit's in each organ. But when there's that emotional trauma, there's that shock to the body, and the spirit no longer feels safe. So it wants to leave the body. So very commonly you'll see, and I'll show some pictures today of patients who've experienced this really severe emotional trauma, and their spirit has really left their body. So we have to get their spirit back into their body. Another thing that happens is the pericardium tightens. So we know the pericardium acts like the gatekeeper. It decides what comes in and out of the heart. It decides the blood flow to the heart. It helps to vent heat in and out of the heart. It also helps to decide what emotion goes in and out of the heart. It regulates that. So when there's an emotional trauma, the pericardium tightens to protect the heart so there's not all that emotion coming in. which is a good, safety mechanism. It's a great inherited mechanism that we've had. But if that emotional trauma is locking in the body, the pericardium stays locked and holds that emotional trauma in the heart, in the body. And then because of all this scattering of energy, energy becomes blocked in the channels. That can create a whole host of things with heat or cold or phlegm. All these different types of evils can then become blocked in the body and trapped in the body. So here's a gentleman who experienced emotional trauma. His wife had recently passed away just a couple weeks before this picture was taken. And you can see here, if you look at his eyes, I mean, his eyes are very glazed over. You can see, of course, the sadness, the lost look, but also there really isn't Shen there. His Shen is not in the body. And you can also just see by his expression, just the coloring of his face, the Shen has left his body. Is no longer animating. It's not glowing through the skin or glowing through the eyes. There's many other things we can see on the face, of course, the red nose and other things, which I'll talk about more on this weekend. I have a case I'll present of his full case. But we really need to ground that spirit, ground the energy, bring the spirit back into the body and calm the spirit. Now, the second stage of trauma, like I said, it's when someone's reliving that trauma memory. That intensity of the emotion gets triggered. We know this as PTSD, and it creates heat and wind in the body. And because that heat and wind, things are stirring, and there are more blockages created. And then that can create rebellious chi. And we'll talk more about that. So here's a woman who was reliving a trauma memory. She was someone I had treated years before this picture was taken for trigeminal neuralgia. And at the time, it was intense. She could not eat solid food. She was taking high levels of medication. She was incredibly fatigued and had poor concentration. But through acupuncture, we got the medication down. She could start eating food again. It was great. But then what happened is one morning, she woke up, took a bite of food, and had a flash of pain just for a second. But that flash of pain triggered her, memory of how intense the pain was in the past. It was daily. It was something she was having to deal with that was so intense. And so she was very shocked. And you can see here on this picture, her eyes are also glazed a bit. And the Shen is not animating behind her eyes. And same thing with her skin. We can see other things about colors on her face. We can see some redness on her cheeks. That's the heat coming up. You can see the duskiness in her lips and the redness to her lips. That's also that heat in the digestive system. So we see these kind of things. Now, the third stage is really when there's unresolved trauma just stuck in the body, and it creates excess conditions. So we can have, heat, cold, wind, damp, blood stagnation, chi stagnation. But over time, these excesses create deficiency. So the deficiency can be a whole host of things. It can be yin and yang deficiency, chi and blood deficiency. And this is where Chinese medicine really shines, because we can use our differentiation through our diagnostic techniques to figure out how has that person been affected by emotional trauma individually. And that's really what we're looking for. We're looking at these different stages. There's kind of the initial stage of scatter that happens for anyone who experiences emotional trauma. And that reliving the emotional trauma, same thing, you're going to get heat and wind. But each person's going to respond differently in terms of symptomatic patterns. So we have to use diagnosis. So this is a quote that Dr. Wong, my teacher, used a lot when he was teaching from the Nanjing about the point you need to use more than one diagnostic method. I'm not a huge fan of the wording here about superior and inferior, but the point is you want to use more than one diagnostic technique. Now, everyone out there, we have people from all over the world, and it's great. You guys have many different things you can use. I mean, you can use palm diagnosis, ear diagnosis, face diagnosis, pulse diagnosis, tongue diagnosis, whatever you use. You want to use a couple, 3 or more diagnostic techniques so you can bounce them off each other. For example, someone comes in and they have a red nose tip. In face reading, this means heat in the heart. Okay, great. But then we check the tip of the tongue. It's not red. We check the left distal position for the pulse. It's not rapid. It's not tight. We check the heart channel. Around heart 7, heart 8, no nodules. Around pericardium channel, pericardium 7, pericardium 8, no nodules. We don't see heat with any other diagnostic signs. we can disregard that red nose tip. It's not significant. So that's why you want to have multiple diagnostics. So this weekend, we're going to talk in depth about the different diagnostic methods that I use. I use facial diagnosis from the Lillian Bridges lineage. I use channel palpation from the Dr. Wang Juyi lineage. I use pulse diagnosis from the Shen Hammer lineage. I use tongue diagnosis. I also use spirit level diagnosis. And I'll talk more this weekend about what that means. But it's feeling the spirits. It's getting a sense of the different spirits, the Jur, the Hun, the Shen, the Yi, and the Po. How do those feel? How do those present? How does someone behave when those spirits are out of order, either constrained or deficient? So when we diagnose the trauma, we have to look at three things. We're looking at the scattered chi. We're going to see how do we diagnose that. We're going to diagnose that surge of the trauma memory and also the individual imbalances. Here's someone who came in who had had emotional trauma in her 20s in a previous relationship. She's looking at the camera, but her eyes are not looking in the same direction. You can literally see the scattering that's happened. She had not come in saying she had emotional trauma recently, but we were working on, there's many facial diagnostic signs to show this, but you can see here her eyes are not looking in the same direction. Her body's been scattered, her Shen has been scattered. So through treatments, starting with, we'll talk in this in a second, the staging of treatments, but through treatments, she started feeling better. She started feeling more empowered, and we really worked with her to feel strong as, as the strong woman energy. And she really started feeling that. Continue with treatments to help release those triggers and to soften and to soothe the trauma memory, I call it, soothe the trauma memory. And then work on some of her individual imbalances, and then she started feeling a lot better. You can see here the change of her eyes, and also her eyelids are more open. When I was teaching this in England, someone really mentioned, oh, look at her eyelids. And that was a great thing to point out, because if you see the eyelids represent the pericardium. And when the pericardium is tight or not feeling safe, they're going to be lower. And then when someone feels safe and their pericardium is more relaxed and regulated, you see their eyelids opening more. So that's something that we see as well. So when we treat emotional trauma, we're looking at 3 stages. And this is an approach. This is what I've learned through my teachers and through treating patients here for the last 19 years. But there's other approaches out there. I just encourage you guys to try this. I've been teaching this approach now all over through webinars all over the world. I just got back from Australia, and people are finding this to be beneficial. So I encourage you guys just to at least try it. And there's 3 stages. The first stage I call gathering the chi. And that really is mothering the body. What does that mean? When someone has an emotional trauma and they've been shaken up, what's the first instinct you want to do? You want to hug them. And so this treatment is like that, kind of cosmically, energetically giving them a hug, feeling safe, and so they can feel that they have the ability to process the trauma. They feel calm and settled. And so that's really the first stage. The second stage is soothing that trauma memory, because even after you get them settled, something can trigger that. Like, say, for instance, I had a woman who was in a car accident, and she was in an accident with a red truck. And ever since then, when she was driving, she was very scared. She used to be a wild driver, very confident, just blasting down the road. And then over time, because she kept remembering the accident, she became very timid behind the wheel. And if she saw any kind of red truck, she would think that truck was driving towards her. She would literally partially kind of hallucinate. And a lot of these things happen with the sensory changes. And so through treatment, so eventually she couldn't even drive. So through treatment, we got that triggering to settle down. And so she, of course, didn't forget that she was in a car accident, but she could then drive again. And she started becoming a hellion again on the streets. I don't know how good that was. But the point is, she was able to not be so triggered by that intense emotion. Then after we have that memory settled down, we can start addressing the body on an individual level. Eric, they're more big picture. They're helping to get the dust to settle, so then we can really understand how did that person become involved or affected by that emotional trauma. Because what I found, let's say someone comes in after a car accident, they have whiplash, oh, my neck hurts. You do the best points possible for whiplash, you're not going to get much effect. And the reason why is the body is so out of order the channels are not communicating well. So you really need to gather that chi before the body can start responding to these individualized treatments. And I found that time and time again. I've been tempted, somebody comes in, oh, I hurt my knee. Okay, let's just do a knee treatment and I'll deal with the emotional trauma later. It doesn't work. Okay, so with gathering the chi, there's a few things that we're looking at, and I talked about this earlier. We want to center someone, help them to get calm and to help benefit that earth element. Benefit the E, the intent, that spirit of the earth, the E, to be able to process smoothly, get things back into order. We want to ground them. And then we want to stabilize their spirit. We talked about that, rooting the spirit and helping to get their body back connected with their spirit. There we go. Okay, so I think I'm back. Can you guys hear me? Great. Yes, maybe I was triggered by an emotional trauma. Who knows? Sorry about that. I have no idea what happened. I didn't touch anything. Although I'm not the most tech-savvy person in the world, so I hope I didn't hit the wrong button. I doubt it. Okay, so stabilize the shed. Yes, everybody who's curious what the points are, just 1 second, I will tell you those. regulating the blood, mothering the body. So we're trying to do that through gathering the chi. So the points are, like I saw someone type in, those were correct, except you're missing one point, that's yin tong. So the points are yin tong, pericardium 6, ren 12, zhong 1, and san yin jiao, spleen 6. So these points help with gathering the chi. And this weekend I'm going to talk in detail about how each one of these points does that. There was a previous webinar that I did on eLotus for 1 hour that's called Gathering the Chi. If you guys noticed, this one was also called that. I forgot to change the title. Sorry about that. And so that one I do a detailed analysis of why each one of those points is chosen for gathering the chi, because the intention is so crucial. You know, if I needle a point, or my teacher, Dr. Wei Chia Young, needles a point, the exact same point, same location, everything, of course, the response and the result is going to be much better with Dr. Young's needling than mine. Why? Because he has so much experience and so much thought and so much intention into those points. So really, when Dr. Young teaches me acupuncture, one of the most amazing things he does is teaching me theory. You know, it's not about what the protocol is necessarily, it's why are the points used in that protocol, because then you can apply the points for all sorts of conditions. You have to memorize, oh, for knee pain, it's just this string of points or this string. You understand why certain points work for knee pain and how you can extrapolate that for other uses. So with gathered chi, I use many things besides acupuncture. I also use herbal formulas. There's an herbal formula we're going to talk about this weekend that's very effective that I learned when I was studying in China from the head of the psychiatric department. It's very effective for many cases of emotional trauma. I also use drumming, so I thought I would just give you guys a little preview of the drum and how that works. Now this microphone is what it is, but I would ask you guys all just to go inside, go internally, and just see how this drum feels in your tissues, in your body, and how this is how you experience it. Still breathing, still taking your eyesight within, listening within. Okay, then just slowly opening your eyes. This is something I do a lot in here for not only emotional trauma, for many conditions. The drum is one of the original Chinese tools in Chinese medicine from the shamans of up to 8,000 years ago. And I use the drum a lot in my practice. You can even feel maybe your energy shifting, and you probably heard that steady drum beat that I use. That's called the shamanic journey beat. Many cultures use this drum beat. It's also used in China by the shamans. And then I incorporated the earth element rhythm into that shamanic journey beat just then, because we are in the earth time right now, being in the month of April. This is the time when the energy goes back to the earth before I move forward to summer. And so I use different elemental rhythms to also work and to treat organ conditions, a whole host of disease patterns. And you can go to my website, redwoodspring.com, and I have a free recording on there of the earth rhythm if you guys want to hear that. There's also some videos up of me playing the drum as well. So I use a drum a lot in my clinical practice, and it's very effective. I also use Qigong and other modalities too, which we'll talk about this weekend. The next stage of treatment, after we have someone gathered, and so sometimes that's one treatment, sometimes it's 3 or 4 treatments. It just depends, and you have to read the diagnostics, and we'll talk about this weekend, the different diagnostic signs that really indicate scattered qi. And then you know when to move to the next stage of treatment, which is soothing the trauma memory. So soothing the trauma memory, what we're trying to do is bring down the cosmic water, connect with Father Sky, and the shamans and in ancient Chinese medicine, this is part of the true core of working with heaven and earth. You guys have heard this, of course, many times. And Do 20, of course, is the point where the heavenly energy enters the body. So that is one point in the protocol. And we're trying to bring down that cosmic water to calm that heat, to soothe the body, to put out that wind, dispel the wind, and to nourish the body. And so when that memory gets triggered, people do not have that intense emotional response. Now, the points that I use, these are in the textbook, and I will share these with you guys as well. There's a very special needling technique that I'm going to be talking about this weekend, but I use Do 20, governing vessel 20, Bai Hui. I use Shen Ting, which is governing vessel 24, Do 24. And then points that are about 1 soon out. It depends on each person, but about 1 soon out, sorry, 1 to 2 soon out from Do 24. And these points are incredibly effective, and they're usually paired with some other big points that sometimes I'll incorporate a little bit of this gathering chi treatment with that, or maybe some other big points like other 8 extraordinary points, or things like stomach 36 or whatever along with these. And they're really effective to help with soothing that trauma memory. So in a Western medical standpoint, we're working with the 3 lobes or the 3 aspects of the brain that are affected by emotional trauma: the prefrontal cortex, the limbic system, and the brainstem. And I'll talk more in detail this weekend about how these points, through a lot of research, actually help the communication between the logical brain and the emotional brain. Now, once we have this trauma memory soothed, then we can move forward to about working with the individual imbalances and how did that person specifically get affected by emotional trauma. I just glanced down and saw a question about inherited trauma. Yes, in my book, I do talk extensively about inherited trauma and how to treat it. If you do have the book, it's in chapter 5, and I talk about the Western medical research that's been done, and then how we can use Chinese medicine to treat inherited trauma. And I treat that here in the clinic, and it works very well, actually. But what we have to do is really identify how has that person been affected by the emotional trauma. Do they have heat? Do they have wind? Do they have phlegm? Do they have cold? Do they have yin deficiency, yang deficiency, qi or blood deficiency? We have to figure out what is going on for them because they present with different symptoms. And so emotional trauma incorporates many symptoms, and they're really broken down, at least I break it down, into emotional, behavioral, and physical. For emotional, it can be a whole host of emotions. We're talking about, anger, fear, worry, mood swings, many different kinds of things like that. Then behaviorals, what is that? That can be avoidance. This one patient she's in her 20s, who had an emotional trauma when she was a young girl, and she couldn't leave her house. She couldn't even go to the grocery store to get groceries. And then through treatment, she was able to, and we'll see these pictures actually over the weekend, able to engage in life again, go out of the house, actually leave to go out of town to visit friends. She decided to start a business. It was amazing. I mean, it was an amazing, miraculous shift. But there's other things that happen too with behavioral. We have people self-harm, cutting. And I had a patient who was literally banging their head against the wall, and then through treatment that settled and then cleared. And then, of course, physical symptoms. We know about this: fatigue, insomnia, poor concentration, body pains. This all can happen as well. And these can be, people usually have more than one of these, and we have to look at how are those differentiated in the books. And someone was asking about that. In the book, I do differentiate each one of these in terms of Chinese medicine and the different point combinations, the different herbal formulas, the different affirmations, all the things that can be used to treat each one of those differentiated. But it really comes down to diagnosing. We have to use our diagnostic tools. So facial diagnosis This is incredibly helpful with emotional trauma and all, really all disease patterns, different lines relating to different emotions. Pulse diagnosis, of course, another big one that we're going to use. Channel palpation. I'll be talking a lot about channel palpation this weekend. Like I said, I've been studying with Dr. Wang Juyi since the late 90s until he recently passed away. And it's amazing what channel palpation can do for treating. I use channel palpation every day here in the clinic. It's incredibly effective. And I talk about different ways the channels are affected. So for example, let's say someone has a water element imbalance. We're going to see things on their channels like maybe a dip, an indentation at kidney 3 or kidney 7. Sometimes I'll feel a stick, and I'll talk more this weekend about what that means at kidney 3. You might feel nodules. You might even see vessels. You know, a lot of people, when they get concussion, you'll see vessels at kidney 2, and there's a very effective technique for treating that. And then you want to check the pair channels for the water element, of course. In terms of facial diagnosis, we're going to look at the area under the eyes. We're going to also look at the chin. You can see here on this woman, the chin has some dimpling. There's some lines there on the chin. This relates to fear. So the chin relates to the kidney, and we see lines or cracking or dimpling or orange peeled kind of skin. That's affecting the kidneys and the fear. For the pulse, you know, some of these things you guys know in the proximal position, deep, empty, weak. These are things that can, you know, really relate to the kidney being affected. In terms of the tongue, a really interesting sign that I learned from Barbara Kirschbaum's book. Actually, if you guys have Barbara's book, it's an amazing book, The Atlas of Tongue Diagnosis. In the back, when you look at a tongue, if it has a dip in the back, that's an inherent kidney deficiency. So there's just different things that we can see with the pulse and tongue and channels and face that let us know if there's a certain element that's out of balance. Okay, so we identify what element's out of balance. Then we have to really identify what channel are we going to select. And there's many things that we have to take in consideration. You know, do we choose the same channel that's affected? Do we choose its paired channel? Do we choose the same name channel pair, like we're talking about kidney, that's on the Shaoyan channel, so we use the heart? Or we use the same moving channel resonance pair. What does that mean? That's the channel connected through the Neijing, where the kidney is connected to the Sanjiao. I'm going to talk more in detail about that, but many point combinations follow this. 5 elements, we incorporate that. And I also use heavenly stems and earthly branches. I'm going to talk about that this weekend. How do we treat by the seasons? I treat each month differently based on what channels are open. So we select a channel, whether it's going to be the kidney channel, or maybe it's going to be the urinary bladder channel, or maybe it's going to be the Shaoyang, the Sanjiao channel. There's some kidney, we might use points on the ear. But then we decide what points are we going to use on those channels. And so we're going to look at this weekend, the 5 Shui points. How do those relate in terms of emotional trauma? How can we utilize the function of each one of those 5 Shui points for determining what point we're going to select? If somebody has an issue with expressing, what's a really good 5 Shui point to use for that? We can look at source points, collateral points, cleft points. I'm also going to talk a lot about Master Dong style points, Master Tongue style points, and also experiential points I found that are really helpful in the clinic too. So for example, somebody comes in with a water element imbalance. Let's say they've had a lot of shock and trauma that's upset the microcirculation in their system, in their channels. We can use heart 5 and kidney 6 to help improve the flow in the channels using the low point on the heart channel, and then we can use kidney 6 for the yin chao to help open up. This comes from Dr. Wang. I'll be sharing a lot of Dr. Wang's famous point combinations this weekend. Then another point that's used a lot to help with the kidneys is Shui Gene. It's located here on the chin. You can see in the diagram 10-10-20 here on the chin. How you needle this is you start at the chin and you thread a 1.5 soon needle up into the cheek. And I'll be demonstrating that this weekend. And it's a very gentle technique. There's no pain. It's very easy to do actually once you learn the technique. And this is using the kidney. We just talked about the chin being the kidney. And the cheek represents the lungs by face reading. So it's an old shamanic idea of using the kidney to grasp the lung cheek. So it helps to benefit the kidney and the water and the metal elements. Now, say someone has emotional trauma that's really upset the fluid circulation in their body. We check that, through the channels and through pulse and through tongue. We can use red 9 and kidney 10. Use the Hussey point. Along with red 9, this is used a lot for edema in the body. And this can help with the water circulation. Let's say someone, like we talked about, or they've had this excess condition, the trauma has been triggered for so long, they've eventually become very deficient. So we want to help strengthen the kidney energy. Kidney 3, that makes sense, right? You guys know why that might be there. GB39, because it's the sea of marrow. But Sanjiao 4, you guys know probably through, maybe lists of points, that Sanjiao 4 helps with the source chi. But the reason why is because the Xiao Yang is paired with the Xiao Yin. So we're going to talk about that more this weekend, why that would be so important. GB31 deep. This is a really effective point to benefit the kidneys, especially when you go with I use a Fortune needle actually, and go down and just tap the bone. Just tap it. We're not trying to stimulate the bone, but that is guiding the energy to the bone, to the kidney, to benefit the kidneys. This is really good. You guys might have heard of this through Richard Tan. I studied with Richard Tan, and he talked about using this point for TMJ and for teeth clenching, but I never understood why until I studied with Dr. Young, who was a direct disciple and apprenticed with Master Dong, tongue style acupuncture, Master Tongue, for several years. And he explained why this point works, because it's on the Xiao Yang channel for the Xiao Yin, but also because we're going down to the depth of the kidney, to the bone. Now, sometimes people have this triggering of emotional trauma, and it's causing so much heat in the body. We have to vent the heat off. We can use Sanjiao 5 and use kidney 7. Kidney 7 is the metal point on the water channel, so it's going to generate fluids for the kidney. So we'll be talking about all these kind of ideas to this depth for all the elements, for all the different types of conditions that can happen. Then we're going to even take it to another step from there and talk about how do we treat by the months. Each month, different channels are open. I don't have time right now to explain all of that, of course, but this is from my teacher, Master Zhongshan Wu. This is from the shamans who really looked at the stars, the moon, the sun, to understand the flow of energy by each month. And we'll talk about why I might select in April small intestine 4 or heart gate, which is another tongue style point. We'll talk about that later. And UB23 and UB64 versus doing those other points I mentioned, Sanjiao 4 and GB39. So these are different things we can use. I do a lot of bleeding. We'll be talking about bloodletting this weekend. I have videos of me doing bloodletting. It's a very safe technique. It's very effective, and it works very well for emotional trauma as well as many other conditions and this kind of thing. I also use cupping. I hope you all out there use cupping. And I'll be demonstrating cupping this weekend and how we can use it for treating emotional trauma specifically in different areas of the body for the upper back, middle back, and lower back. Even lower back's not on here, but lower back as well, and shoulder. Bloodletting, like I mentioned, and also prevention techniques. The thing is, once we've got someone gathered their chi and help them to feel centered and able to feel that ability to love themselves, to feel like they have the strength and the calmness in their spirit, to then start processing emotional trauma. Emotional trauma is labeled that because it is traumatic. It's very intense, and most of us have emotional trauma that's occurred in the past, and it's stuck in our tissues. And to think about that and to want to deal with it is intense. So we have to have someone feel safe and settled to do that. So once we've had that happen, then we're soothing the triggering of the memory. Then we've kind of helped them to process their trauma. I'll show a slide in a second of a patient who hits a significant transformation. But then what happens down the line? What happens in the future? And so in chapter 5 of my book, I talk a lot about this, preventing emotional trauma and helping to prevent passing emotional trauma down to the future generations. We know in Chinese medicine, and this is also in Native American, a lot of indigenous cultures, the idea of 7 generations before us and 7 generations after us. And we want to help instill this calm, peaceful energy to future generations, even just energetically to our, the human family. So what are things that we can do to help shore up our energy to prevent the impact of future emotional trauma? And so we're going to talk extensively about nutritional things. Now, you guys, I know have studied nutrition. But we're talking about it from a traumatic point of view, like how do we prevent for that way, and also some recipes. I'm going to give you guys recipes that I found very effective. I studied with a culinary teacher who's a Taoist priest and also a practitioner, Nam Singh in San Francisco. I got my graduate degree in ACTCM in San Francisco, but I studied with Nam Singh, and he still has a school there. But he specifically cooks with Chinese herbs, and it's very effective. We're talking about sleep, lifestyle ideas, qigong, drumming, this kind of thing. So I want to show last set of slides before we go into some questions here of a woman who had experienced emotional trauma. She was on vacation with her partner and another couple, and in the middle of the night, her partner had a seizure. She had never had a seizure before. This scared this woman, and she went and got her friends. They came. Her partner, she was still seizing. They took her to the hospital. Then she got medication. Everything was fine. That was traumatic. But what it triggered for this woman is when she was 9 years old, her father had a medical event in the middle of the night. She found her father. She went to go get help. When she went to go back to her father, he had passed away. This is incredibly significant. Of course, it happened when she was a young girl, and it had been something that had actually haunted her, but she had kind of just put it in the background. Like I said, it's intense to have to deal with emotional trauma, to think about it. So she just kind of put it in the background. And we'll talk about, she actually pushed it down to the daimai, the belt channel, the girdle channel, in extraordinary channels. But at any rate, she had pushed it away out of her consciousness. But having this recent event, it brought everything back full steam. And you can see in this picture, you can see here, we talked about looking at the shen, looking at the eyes, looking at the light coming out from behind the eyes. This woman, of course, is here when I'm taking this picture. She was in the room, but she's not there. Her spirit is not there. And you can see in her skin too, her skin's just kind of pasty. It's not that glowingness coming out from her skin. So, of course, started with gathering chi. Now, this is the woman, if you guys remember back when I was talking about the water imbalance, we can see here her chin. There's that line on the chin. And there's many things we can see on her face, actually. This is the case from the book. So if you guys are interested, if you have the book, you can look in the back. This is one of the cases I go in depth about the different things that we're seeing on her face. There's many things we can see. But the big picture is the shen is really has really left. Her spirit is left. So I, of course, started with gathering the chi and did that treatment, and she got better. She came back and said, oh, wow, I feel better. And one of the points in that treatment, like I mentioned, is yin tong, and that is located here, of course, in the third eye, and it relates to opening the perception, opening the third eye, the ability to see the forest and the trees. And she had this aha moment. She realized that because she had that emotional trauma when she was a young girl, she never felt really safe or secure, really able to go out into the world, which is really what we try to do with Soothe the Trauma memory treatment, is we try to help someone really instill that fathering to be able to feel strong to go out into the world, that yang energy. So started doing Soothe the Trauma memory treatment, and she started feeling better. Now you can see here there's a transformation. Number one, she's sitting more upright. So there's that upright energy. You can see the glow starting to happen in her skin. You can see some light coming from behind her eyes. But you can also see a little bit of she's working through this. She's processing right now. So what happens is someone feels strong and secure to then really bring it up. Pema Chodron, for those of you who do meditation, you might know Pema Chodron, and she talks a lot about, we're all these bodies of water, and we stir the water, we stir it, so then it kind of gets it murky, we can't see, but then when we still ourselves and calm ourselves, just like you might have felt with that drum, it stills all the water, and then you can see the trash below. So we all have trash down on the bottom of our lakes, and we have to deal with it. And so when we're able to get someone still and calm enough, they can start processing. So she did, and then she felt a lot better. So you can see here the light coming through her eyes, the light behind her skin. She also got taller, which I thought was amazing. So we'll talk more about her over the weekend, but I just wanted to show you guys another transformation picture. So if we have time, if you guys want to type into the text box here any questions, we can talk about that. I see one thing here about the question of mothering and fathering. Again, that really is individually based. Sometimes, like for that woman I just showed, I only did one gathering of the chi, and then I could start doing soothe the trauma memory. It just depends, and we'll talk this weekend about what are the diagnostics we're looking for before we can transition to the next stage of treatment. Fathering, that's that idea of really getting the trauma memory to settle down. That's kind of, that one you can tell by even just asking someone, now that you're having this, we've done these treatments, and when you get triggered, does it seem to be as intense? You can also see things change, like they're not as flushed, maybe their eyes aren't as, there's not the glossiness to their eyes. Then we can start going to the individualized treatments. So that's something that I look for, and I, through talking to them, but even more importantly, through the diagnostic signs, like checking their pulse. Is their pulse feeling scattered? Checking this kind of things. I have worked with schizophrenic patients, and I want to say this is I'm glad somebody's asking this, because I do have patients with some pretty extreme or just strong medical diagnosis, serious medical diagnosis. I want everybody I treat to be also seeing a counselor, a psychologist, a psychiatrist, because I think it's very important as us as practitioners, we're working on the somatic level. And so someone has to be able to express these things that are happening for them as they're processing. So it is very important for them to see a professional. I have worked with schizophrenic patients. In fact, when I was in San Francisco and I was still in school, I worked in an outpatient psychiatric ward where patients to be enrolled in that program, they had to have been hospitalized twice in the last 6 months to be eligible to be in that program. We were doing ear acupuncture and some body treatments there, and it was really effective and very phenomenal. And that was really what started me thinking about, how do I treat emotions? How do I work with this balance of spirits? And so I encourage you guys all to be with us this weekend. We're going to be doing a 2-day class for eLotus, and I'll be doing demonstrations. I'll be doing some drumming. And if you guys want to even just get some more information about me and get an idea of what it's like to see me teaching in class, I have free videos on my website, redwoodspring.com. I do face readings. I do, of course, treatments. And you'll be able to see these different seminars that I teach. I teach all over the world. I do different podcasts. I do different webinars. And there's some free podcasts and webinars on the website you can watch as well. So just go to that Watch Listen tab. And I do cover trauma that's at any age. This last question somebody asked, do I talk about trauma? I talk about trauma that happened in the womb. So I talk about trauma that happened inherited before they were even born, the trauma that got passed literally in the sperm and the egg. So I talk about all these different levels of trauma, all the different ages that can happen, and that even actually affects different organ systems depending on what age it happens. And I'll talk about that as well. So I want to thank you all for tuning in today. I encourage you guys to join me this weekend. Thank you for everybody for being, coming from all over the world, people waking up early or being up in the middle of the night in Europe. So thank you so much. I really hope you all enjoyed it. And I look forward to seeing you guys this weekend.
Thank you, CT, for a great class. And thank you, everyone, for joining us. I hope that you were able to take some clinical pearls from today's webinar. And there were actually a lot, so I hope you were able to take notes. And we do hope that you join us for the full weekend class. It'll be this Saturday and Sunday. It'll be 9 a.m. to 6 p.m. There's a 1-hour lunchtime between 1 to 2 p.m., so it's actually not 9 hours long. Other than that, we are going to conclude today's webinar. It has been recorded, so if you want to watch it again, you can find it on our TCM Wisdom Tube tomorrow afternoon. That's it for today, everyone. Thank you so much, and we look forward to seeing you this weekend. Bye.